Is the patient breathing?
No, he's collapsed. It's my dad.
Okay.
Not breathing, he's cold.
Okay, we're coming as quickly as we can.
How long is he going to be?
We're coming as quickly as we can, okay? So I'm organising help for you now. Stay on the line and I'll tell you exactly what to do next. Okay, so listen carefully. I'm going to tell you how to do chest compression.
I went in to John, and as I went in, he fell forward and said, "Help me." The ambulance was saying, "Say to him, John squeezed my hand." So I said, "John squeezed my hand," and nothing happened. And then I started to resuscitate him. I saw the line, you know, like the flat line. And I thought, oh God, you know, John's dead, you know. And the thing I most remember about that night, we had at home, we've got this long footstool and it was being recovered, and I walked in and the kids were sat on the floor with their knees like up like this. That's the one thing I remember. And I remember saying to them, "Dad's gone, we've got to be brave," you know. Within about an hour the undertakers came, and I remember them saying, "Did I want to stay while they sorted him out?" And I said, "Oh no," and we went in the hall. And I remember hearing the zip, you know, the zip of the bag, and I don't know, I think then you think, what happens now? They've gone, you know.
I think to say yes to that question is very difficult, because I think saying yes to that admits defeat. And I can tell you that myself, my colleagues that I work with, and I'm sure other neurosurgeons all around the country, will fight tooth and nail to get the best for their patient. And I know that we do that day in, day out. But there comes a time when you can keep fighting and actually you don't get what you want. And I think there is going to come a point where there is a finite resource to fund neurosurgery. And it's not just paying for the nurses and the doctors, it's paying for the equipment, it's paying for the expertise, it's paying for the training of the next generation so that we can be the world leader. We already lag behind Europe and some countries in our outcomes for cancers as a whole. And if that trend continues, then we will see a compromise to the outcome for patients with cancer in this country. And that has to be avoided at all costs.
I'm here today because my husband, Richard, died of a glioblastoma in March of this year. Richard, although he'd had a diagnosis of 3 months without treatment, 12 to 15 months with, he was determined to really give something back in the last few months, few years of his life. So he threw himself into working with Laura, both fundraising and supporting Laura in project managing the garden.
The garden is hugely beneficial to our patients, for them just to be able to have a little bit of time to sit and just de-stress. When people are sort of having anxiety or feeling very overwhelmed, that's very valuable. To be able to get people out into the garden area to start them back on that track to sort of independence.
With the equipment that you have funded so far has made the operation safer and quicker to position. The equipment we're looking to fund are used for particularly paediatric patients, removing tumours deep within the brain. And what it's allowed is to do surgery through a tiny, tiny hole deep into the brain, remove tumours which we would have previously thought were inoperable, or if we were going to operate, we'd have done a huge incision and had to cut through a large section of the child's brain. And this, I think, when we see the results of this borne out, as it has been in other units overseas, will be life-changing for these patients. Cutting length of stay, weeks to days, making the surgery safer, the recovery faster, smaller wounds, and particularly and importantly, shorten the time from surgery to being able to start that life-changing treatment straight away.